Hi everybody, my name is Steven and I'm came from Indonesia. As we know that Indonesia already become the fourth biggest populated country in the world, with about 2 to 3 of total population is dominated by the youth. Now it is a very good opportunity for Indonesia to create a better human resources in order to become a next leader or people that can create a better place in this nation. But people still have the perception and paradigm where the quantity is good than the quality. But the parameter of a good human resources is when the people, without prioritizing about the quantity, but they have a good quality. So, in the other hand, we see the youth, they do a lot of research and unsafe sex that lead till the end result to a pregnancy. It is very emergency that we have to, as fast as possible, to take action. Why? Because, for example, in Indonesia, in fact that we can say only for a decade that the birth rate for youth especially already increased by 37 per thousand to 48 per thousand. Now it is very bad because it's going to increase year by year.
This problem occurs, it is because the lack of information of the youth regarding themselves, which is the main issue that discussed here. It is the youth reproductive health. We say this is very crucial and very important for the youth to understand and a lot of information about the youth reproductive health, because till the end it's going to become a protection, a shield for them to out of any kind of harm or distraction that going to distract them or attack them. And I'm personally here going to share a program or a community that exists that especially can cater and provide every single need regarding the youth reproductive health. I personally already experienced in a community, as we called it, as a central of information and counseling for youth, or in Indonesian we call that as a PIK-Remaja. In Indonesia, this program was created by BKKBN, the Indonesian government institutions that especially catered any single problem and issue that faced by the youth, just like the premature of the marriage, and then this program going to help by creating a counter proposal about the maturation age of marriage. And also we keep promoting and also socializing about the family planning program. Like in Indonesia we have the hashtag 2 children is enough, and we have done through this community. This community is a good and such effective tools and means for the youth to get a lot of information about the youth reproductive health. We provide you 2 kind of services. The first is the facilitator that have the duty to provide all kind of information that the youth need regarding themselves, and of course the prioritizing focus on the youth reproductive health. The second is the counselor. The counselor here is going to give you a counseling and consultations about any single problem or trouble that youth face in current condition. For example, when you got a psychological or even a physically harm or distraction, you can come to the counselor in the community, and the counselor will provide to you an option of a solution that you can have and choose to become the solution that you are going to fix your problem. This program is very special because we have already proven through our life experience in this kind of organization, where the teenagers and the youth will become more open about their information about their reproductive health and about their sexuals or any single things that even a very private thing, rather than when they are going to have to do a relation or connection with other parties. And it is very effective, so we can directly connect to the problem and main trouble that the youth face. I believe that the information exists is very much enough to let the youth understand very well about the issue regarding the youth reproductive health. But the problem is that the means, the channel that this information going to be presented to them is very important. And I say through my life experience that this community is the most effective way and channel that can help to provide the information to the youth. So I already experienced in this community in Indonesia, and this time I want that all of the youth around the world can also experience the same thing as what I already done, and still experience in the community for now. So till the end, let us start now to help promoting this kind of program and this kind of community to be implemented, to be provided in all countries around the world, to help the youth to get a better information and better life care about their reproductive health. And it's going to give a very helpful outcome in doing the family planning program. So till the end, let's start from now to do more advocations and to become the actor in the community as a facilitator or a counseling. Until the end, we have to start from now to take the actions. Thank you very much.